What about preeclampsia and eclampsia? Can you talk about those complications and what's the cause of it?
Sure. The term preeclampsia is really a spectrum of conditions that are characterized by hypertension and hypertensive disorders of pregnancy. So it's a blood pressure issue. We don't really know what causes preeclampsia. I mean, there are a lot of theories, a lot of research has been done, but we simply don't know what ultimately causes preeclampsia. In the old days, about 1,000 years ago, we used to call it toxemia of pregnancy, and the thought was there's some kind of a toxin or poison that was circulating through the mother's system that caused it. We know that's not the case nowadays. So the term preeclampsia refers to a very common, specific type of blood pressure disorder. Usually occurs late in the pregnancy, towards the very end of the pregnancy. It's characterized by increasing blood pressure and some other derangements in the chemical processes of the body. If this tends to be a progressive disorder, so in other words, if it gets worse and worse and worse, the patient may ultimately lead to a secondary complication of that with convulsions and seizures, and that's fairly concerning for patients and for the safety of the mother. When the patient does suffer the convulsions and or seizures, that's called eclampsia. So there's a progression of symptoms. The treatment really is trying to manage the potential for maintaining the pregnancy and ultimately is delivering the baby, because once the baby is delivered, a lot of the changes that occur with preeclampsia tend to reverse themselves. So the danger time is actually up until the baby is born and shortly thereafter. Um, we know that about 10% of patients are going to have some form of a complication related to blood pressure issues, and we can identify certain risk factors for that. There are some conditions and the increased risk factors for developing preeclampsia. But ultimately, the bottom line cause of it, we don't know. We can simply identify the potential complications and deal with those possible complications.